boss beauty queens, what is going on, everyone? I have missed y'all so much. If you are new to my channel, my name is Darian and I do nursing related videos, which I know you guys love so much, as well as fitness, beauty, some lifestyle in between. So welcome. I'm so excited that you chose to click on this video. I am specifically so excited for this video because it's a topic that you don't really see talked about very often. And I had this idea probably a few months ago when I started thinking about what they don't tell you after nursing school. So I have everything written down that I'm going to be touching on today because I just want to stay on track with this entire video without getting too distracted, because you guys already know that I could ramble if I don't have exactly what I need to talk about here. So without further ado, y'all, let's go ahead and just jump right into this video. All right, y'all, before we get into this video, I do just want to apologize about my musty, crusty looking nails. Okay, guys, my nail technician is on vacation right now and I just don't know what I am gonna do without her. So I have some man hands in today's video, but I did not want no nails to stop me from recording a YouTube video. So just don't mind my chubby little fingers throughout this video, okay? So I don't necessarily think that all of these things that I'm gonna be sharing in today's video you need to know as a new graduate. However, I do feel like it's nice to know some of these things because as a new graduate, I just felt a little odd during some of these situations, and I feel like I'd rather talk to you guys about them before you guys start going into your work field so you know exactly what to expect. The biggest adjustment for me after graduating nursing school was the fact that I had to now delegate. Oh my word, guys. I can't even begin to express to you guys how stressful learning how to delegate was. It sounds so simple and easy and like, oh, ask someone to do this task for you. No, it is so cringy in a weird way, because as a new graduate, if you're going to a hospital where you know absolutely no one, it's so weird to be this newbie and telling the PCA, somebody, to do something for you without coming across like you're feeling bossy or Miss Know-It-All. Just know that having to delegate is your job as a nurse. Everyone around you knows that you are supposed to be delegating when you need to, okay? So I know it's gonna be extremely awkward in the beginning because you don't wanna come across too pushy, too forward. So be polite when you delegate, go up with nice intentions, being very genuine and sweet. And I promise you guys that delegating does get so much easier as the time goes by and you start to get more familiar with your coworkers and the doctors and the people that you work with on a daily basis. Another thing that I noticed a lot after nursing school was being the nurse of the family now. Okay, this is an expectation to be Miss Little Know-It-All nurse in your family after you get your degree. So do not say I did not warn you. When you graduate with your nursing degree, your family is going to be coming to you for everything. Little headaches, flu-like symptoms, and they're going to want you to care for them the way you care for your patients. So let me tell you guys this one time, know what you're doing because you want to impress the family, okay? So this point is really following the last point that I had mentioned about being the nurse of the family. It's extremely important to note that now that you've graduated nursing school, you are going to be paying that much more attention to your loved one's medical care. And I can tell you guys time and time again, this has been the thing that I am most grateful for since graduating nursing school. It's now being able to critically think on my own, being able to take a step back and ask myself, is that really supposed to be happening? You are going to start noticing a lot of things that either is completely right and everyone on the healthcare team is doing what they are supposed to, or you're gonna realize the neglect that is happening to your loved one, and you are gonna be able to make that connection to speak up and ask them, like, why is certain things happening? You're gonna be able to question and really push them to their limits because you know what is medically safe, what is the standard level of care, and what are you supposed to do in certain situations. Because if something does not look right, you have the ability to stand up and advocate for them. And obviously, if you are not a healthcare provider, you absolutely can 100% do this as well. But I have realized in so many situations that I've been opinion that having the medical background that I do allows you insight to what is actually medically supposed to happen. How are procedures supposed to go? What is proper sterilization? You just know the clinical picture and you're able to tie so many things together. So please guys, say what is wrong if it is happening right in front of you. Do not let things slide because literally it could be a life or death change. This next point that I really want to emphasize on, and it may seem pretty obvious to some of you guys, but after nursing school and graduation, expect to be a full-on nurse, okay? I know it sounds so crazy, like duh, of course that's what we're going to school for and that's why we're graduating. But guys, being a nurse comes with so many different responsibilities, so many different obligations, and it could be extremely stressful. So know and expect that you are going to be working hard after nursing school, okay? It's going to feel like you're in nursing school all over again after you graduate because there's so many different types of classes and courses and modules that you still have to complete. For me, I know when I graduated, I still had to renew another BLS. I had to do my NRP license, so my neonatal resuscitation. I also had to get like my fingerprint clearance card and so many different modules on how to properly breastfeed, how to deal with a hemorrhage, a code, things like that. So know that when nursing school is done, you are going to have a lot more real life nursing school and education when you go into your specific unit. Also know that the responsibilities of a nurse could be extremely stressful and you're just never at ease when at work. You're always thinking on your toes. You're always thinking about what could happen. All right, so this next point that I do want to mention is pretty significant in my opinion, and that is sometimes I find myself being a little bit ungrateful for my job or the position that I'm in life. And I don't say that with any type of greed or an ugly heart. I'm saying that because I need to correct that. I find myself after work sometimes complaining to my boyfriend or my mom about how difficult my day was and how I want an easier job. I'm tired of nursing and this and that and this and the other, guys. And I had my boyfriend remind me that I went through such a hard journey and I've been through hell to get this nursing journey, and I shouldn't take that lightly, and I need to continue to push myself and continue to be a better nurse than before. And I feel like, know that we are only human. You are going to have days where you just don't even want to go to work and you're questioning, why did I go into this work field? But know that you put in so much time and effort and you made so much sacrifices to be a nurse, and that you can do it. The best way that you could grow is when you are out of your comfort zone. So I am learning and continuing to learn to be more grateful for my job, because as much as I love it, like I'm always telling you guys, it could be overwhelming sometimes, and that's just the reality of the nursing field. So know that you did get your degree for a reason and you could absolutely do it. Do not question yourself or your worth. So another point that I do want to mention is knowing that you guys are going to be every single job title there is. You are going to not only be the nurse, sis, you are going to be the PCA on some days, okay? You're going to be that lab tech. You are going to be the pharmacist, because you're going to be needing all these medications that are not getting sent to you in a timely manner. You're going to be having to call med requests, dealing with social work, being the doctor. Like, I am telling you guys, it is no joke when being the middleman of everything going on. If you are the patient's nurse, you are required to know everything about that patient. Just the nurse's title. Unfortunately, I feel like we don't get paid enough, girlfriend, because we be doing so much. It's crazy. So that does conclude this video today. I really hope you guys enjoyed it and you guys took a thing or two from it. I will be catching you guys in next week's upload. Just like always, friends, have a beautiful, blessed rest of your guys' days and weeks. And until next week, bye y'all.